1987, we had money, so much money, we didn't know what to do with it. But the countries at that time, same, no different. They have a tremendous influence over this country for whatever reason, I don't know, but they do. So if you have the wrong president, they'll change the system in 2 minutes. I mean, they'll change it. And the drug companies are very powerful too. You have to deal with them. In this case, it was both. I mean, you had a problem with the drug companies, but you had a tougher problem in theory, other than the fact that I understood how to deal with them. And I'm the tariff king, and the tariff king has done a great job. I hope we win the Supreme Court case, because if we don't, it's shame for our country. Be a shame. We have a great, safe, beautiful country now. We're doing better than we've ever done. We had 42 stock market highs during the 11-month period that I've been here. There's never been anything like it. Stock market hitting a new high again today. So it's it's been incredible. So just to end it on this, because it's such a big subject and it can't be explained by reading. As good as my speechwriter is, he's fantastic, but he can't write it in one sentence what we're talking about. So we're going to get most favored nations. We will be taking prescription drugs down to levels never even contemplated. And that's all great for healthcare, because when you're paying a tiny fraction of what you had anticipated paying prior to today, prior to this month, this all took place over the last month and a half. And the sad part is that when we first announced it, and we did it in a little bit less, more general form, when we first announced it, the Times did a story on page 22 or something, way back in the little story in the back of the newspaper. This is the biggest revolution in the history of medicine in this country, because its price. You're going to buy the drugs for a small fraction of what you were paying for them last month. And I tell the story of my first term. I was the one, after 28 years, that got drug prices down. It was either 1/4 or 1/8 of 1%. I got them down for the year. First time in 28 years. I was so proud of myself. I called a news conference. I said, ladies and gentlemen, for the first time in 28 years, drug prices have gone down for the year. 1/8 of a point. In fact, I had a chart. It was the worst chart I've ever seen. It was a line that went from January to December, and it was dead straight. You had to get a little, like a carpenter assistant to see. I said, this doesn't look good. It's not the greatest line, but I was proud of it, because it didn't. It went down either 1/4 of a point or 1/8 of a point, tiny. And now think of what we're doing. We're bringing medicine down by many times. By many times. Nobody's ever seen. And there are two ways of calculating. You could say 1,000%, 2,000, or you could say 90% or 80%. The Democrats want you to say 90 or 80, but there are two ways of calculating it. You understand that, Dan? And we'll take either way, it doesn't matter. But we'll be paying a tiny fraction. So that's going to go into our plan. And what Oz said is very important. It's very important that whoever is in this office is, strong and intelligent. And if they're not, they could, it could be ended. But what we want to do is we want to have it codified, so it's very hard to change. And that's all part of the process. I think it's the greatest revolution, because it's financial is, a big part of the drugs. And all of the doctors sitting there know exactly what I'm talking about. They have their patients in Europe, and they say, I can't believe it. I'm buying the same thing for, 15% of what I pay in New York or in Chicago. And they're all nodding their heads. That's right. That's not going to happen anymore. We pay now, just to end it, the lowest price in the world, whatever that is. That's what the United States of America will be paying. Isn't that an amazing, long story? I was going to say long, boring. It's not, but to me, it's long and exciting. It's the biggest thing to happen to healthcare. I don't think there's anything we can do. We can do all of our different methods, but there's nothing we can do that can ever top what we do. And the press should treat it fairly instead of not writing about it, because they don't write about it because it's me. Primarily because it's me, but also because it's Republican. And they don't write about it, and they should be ashamed. But fortunately, the public understands it, and that's why we won the election in a landslide. So it's a great thing. Instead of Americans paying the highest drug prices anywhere in the world by far, by 10 times sometimes, will now pay the lowest cost paid by the lowest nation. So the lowest nation, whatever that is, I hope they negotiate a great deal. I hope somebody out there of all those nations is going to be a better negotiator than everybody else. And whatever they get, we get, Mike. Is that pretty good? Good, Mike. Even more, first time I've ever seen him smile. And next, our plan would reduce your insurance premiums by stopping government payoffs to big insurance companies and sending the money directly to the people. So instead of, and this started, and I'm not really a healthcare maven, but I was always a good businessman. It started, I'm reading the paper and I see the money that the insurance companies were making from us on Obamacare. And they're up by 1,000%. 16, I think one was up 1,723%. 1,700%. And it's because of the massive amount of money that's sent to them by the United States government. And I said, why don't we just send it directly to the people instead? And I made that statement. It was a common sense statement. I didn't check with anybody. I didn't even call Ozone, but just made sense. I made a statement and it went viral. Can you believe it? It was so popular. In other words, we cut out the insurance companies. They're making a fortune. And, you know, they're good people. They're business people. I don't blame them. But we cut them out. We pay the money directly to the people. The people love it. I said it, I said it as a non-professional in that business. And I made the statement like, all of a sudden, it's like the biggest story. That one, the biggest story. When I get a call from Caroline, who's around here someplace, she said, sir, we're getting inundated. Margot called me too. Margot, you called me too. Margot, everyone knows Margot. She's been here from the beginning, right from the beginning. But she said, sir, both of them. They said, so we're being inundated by what? You made a statement about healthcare being paid directly to the people into health savings accounts or whatever you want, healthcare accounts. And I said, I did. What's the story? He said, it's it's crazy. It's blown up. People loved it. And so that's where we started. So Obamacare was designed to make insurance companies rich. It really was. I mean, maybe not knowingly at the time by Obama, because he didn't know much about this stuff. It was designed by other people in Congress that were total pros that are bought off by the insurance company. And the problem we'll have with this is we'll get no Democrat votes, even though it should be very bad for them if they don't. But maybe you'll get some. You'll call some of your friends, fellas, and Bob, you'll call some of your friends over on the other side. I don't know how they can reject it. It's just so popular. It's so compelling. So Obamacare was designed to make insurance companies rich with taxpayer subsidies, and I want that extra money straight to the health savings accounts for you. And you can choose your own health care. You go out and negotiate your own health care. It makes people entrepreneurs, many entrepreneurs. They'll pick the health care that's best for them because it's so different. A young person, they need health care for different reasons, and an old person doesn't need certain things that a young person needs, and vice versa. To further reduce insurance premiums, my plan ends the giant kickbacks to insurance brokers and corporate middlemen. We're getting rid of the middlemen. How long have you heard doctors, all these doctors, oh, they look so smart. They're all brilliant people. I assume you're brilliant, otherwise you wouldn't be here, right? I assume we have the best. So we have the best of the doctors, I would imagine, right? Hey, how cool is the White House? Okay? They're always in operating rooms. I wouldn't want to be in an operating. I don't like operating rooms, but they do. But how cool is the White House, right? Coolest place on earth. And this is where it all begins. This is where we came up with a little concept about a place called Venezuela. How did that work out? And this is going to be the same thing in terms of its precision. Its importance is so big. It's going to work just like that. Venezuela was so amazing. But I equate that to other things because we can do other things like that. It doesn't always have to be in Minnesota where everything is corrupt, where they have healthcare centers that nobody shows up and somebody's making millions of dollars, where they have daycare centers where there are no kids. It's a scam. It's a big scam. It's like a horrible thing. We have a country that was great. We have a country that's now great again. It's really come a long way. Make America Great Again is almost going to be obsolete because our country is very close to, we were going to keep America great. We may have to switch to keep America great, but I don't know. There's something about MAGA we should never change. And Susie said, "Don't change." We like MAGA. Everybody likes MAGA. So we want to make this precision, just like a Venezuela, just like the attack or the Iran nuclear weapons, which wiped that out, just like all of the other things we do, they're precision. We want to make it the opposite of Minnesota, California, and all these places that are so badly run. So to further reduce insurance premiums, my plan ends the giant kickbacks to those insurance brokers and corporate middlemen that you've been hearing about for so long. It also funds the so-called cost-sharing reduction program to bring down the cost of the most common plans on the exchanges by more than 15%. And next, the Great Healthcare Plan mandates unprecedented accountability and transparency from insurance companies and all healthcare providers. We want transparency. You're not allowed to ask a doctor how much is it going to cost. You're going to have your heart ripped out, and you're not allowed to negotiate. This is a giant scam. It's, in certain ways, look, nothing can compare to most favored nations. But when you give yourself the right to negotiate, you're not allowed to even ask how much it costs. You're supposed to go into a hospital and get operated on. Then they send you a bill and you have to file for bankruptcy. Not going to let that happen. So we're going to have insurance companies and healthcare providers going to have great, and hospitals, great transparency. The word transparency is a very important word. So they can't get away with ripping you off any longer. It requires insurance companies to make it easy for you to compare plans. You got to be able to compare plans. You can't do that now. You're not allowed to do that. It's not even believable. I tell you what, I used to sit before I was a politician at home, and I used to say, how is that possible? Things happen that I guess it's just the forces of nature, the forces of power, and you end up with very, very badly treated people, and they won't stand for it. But these forces are going to release an earthquake of reduced price healthcare. You're going to have massively reduced costs. This is no longer we're going to cut it by the famous 1/8 of a point. You're going to have massively reduced healthcare, and it's going to be massively better. You're going to have great healthcare at a much lower price, which is the two things. We want great healthcare and we want low price. You're going to have great healthcare at low price. Now you have terrible healthcare at a high price. You have horrible, horrible Obamacare healthcare. Like everything else he did, it was crap. It was a horrible plan. It was from day one and should have never been approved. It was a very sad night that night when there was a thumb raised. Most importantly, will require any hospital or insurer who accepts Medicare or Medicaid to prominently post all prices. You're going to post your prices at their place of business. Something they don't have to do. Something they're not even allowed to do. We'll have the maximum price transparency, and the cost will come down just by that. Not even talking about favored nations. The price will come down. So just in conclusion, I'm calling on Congress to pass this framework into law so that we can get immediate relief to the American people, including rural America. And I hope to get Democrat votes. They saw it. I know a lot of Democrats. And they say our plan is unbelievable. Are you going to vote? Well, I'm going to try. They have tremendous pressure on them. Vote no. Vote no. We have a couple of Republicans. Thomas Massey always votes no. He's like, something wrong with the guy. If you have any clinical psychiatrists in there, maybe go check out his mind. But he always votes no. He's a very bad person. He's a very bad Republican, bad American when you always vote no. Just vote no. Do you approve? No. You know, there's not a thing you can say to him either, Lola. Look, Lola wants to be nice. He likes to get along with everybody. I don't. But they vote no. But so I don't know. You know, you have some people that are very. I call him Rand Paul Jr. Rand Paul always votes. I don't know why he votes no, but I guess he thinks it's good politics. I got him elected twice. If I didn't endorse him, he wouldn't have been elected. But he doesn't reciprocate, and I guess that's okay. But I want to hear now, if I could, from Dr. Raz, and then we're going to have Dan say a few words, and Rob and Mike, and Governor, you're going to say a few words, and we appreciate you being here very much. You're doing a fantastic job. I just want to leave by saying that this is the biggest thing to ever happen to healthcare in our country. It will not be covered that way by the fake news, and that's a sad thing. It will probably not be voted positively by the Democrats, and that's a sad thing. They all know how good it is. I think we can make healthcare into a Republican issue because the Republicans are going to be close to unanimous on this. It should be unanimous. Maybe we won't be unanimous, but it'll be close. But we have a small majority. We probably need a little bit of help from the Democrats. So whatever we can do, we're going to do it. It's the biggest thing to happen to healthcare, maybe from the beginning. So Oz, would you take it away, please? Thank you very much. Mr. President.
Mr. President, thank you for standing up for American healthcare. And I just want to underline this fundamentally important issue. We need Congress to help craft the Great America Healthcare Plan. And the Great Healthcare Plan will work. It's a brilliantly conceived framework. And as it comes to the American people, they understand that they'll want it. And it should represent the analogous situation, similar to what you did so brilliantly last spring with the Working Families Tax Cut legislation that the President mentioned, has created the Rural Health Transformation Fund, which is why we're here today. I want to put a little bit of texture around why this is such an important issue, because the Rural Health Transformation Fund is the largest investment ever in American history in our rural communities. 50% increase in the amount of money that Medicaid, which Secretary Kennedy and I regulate, into our rural communities. $50 billion. You can do the math. It's $1 billion per state, and that's an important factor because it got them competing. There's 60 million rural Americans, and these folks do not have access to the same care that's available in urban and suburban America. Their life expectancy, if they're in a vulnerable situation, is 9 years shorter. So your zip code actually is your destiny. It determines how long you're going to live, and we can make a dent in this because the high rates of chronic disease and other ailments that plague our rural areas are often driven because they don't have access to care. That's going to change because of the sentinel legislation. And again, it's similar teams, same leadership, same president, same Congress that passed the Working Families Tax Cut legislation, which is incredibly popular around the country, and will make the great healthcare plan successful as well. From the day the legislation was signed to create this wonderful fund, this transformational fund, the team at CMS, which was under Secretary Kennedy, began working. And they're here today. Steph Carlton, outstanding Chief of Staff, Alina Chekai, and Emily Chan, that day started working, July the 4th, by the way, on the specific vision for the program. How do you actually get the money out the door in 6 months? The president was insistent, did not want the money in Washington. So we began working closely to make sure that we use the money not as a band-aid, but to empower those closest to the challenges that rural patients face. And who are those people? The 50 people who know rural health care the best? The governors. They wanted the money out of Washington into the governor's hands, and that was done in a remarkable way. The governors thought big. We have one here from Nebraska who was actually the first to start working on community engagement, which is part of that legislation as well. But we have to right size healthcare in rural America, and that's an important phrase. All 50 states submitted amazing ideas to transform rural health care in ways that should have been done decades ago. The CMS team awarded each team their portion of the $50 billion investment precisely with the same precision that we took Venezuela leadership, convicted individual, and with Iran as well. The same precision on time before the end of the year, and got it out of Washington into the states. Now I want to take a step back and do a little thought experiment, Mr. President, if you want to do this. If you, and God forbid this happened, had turned your head the other way in Butler, Pennsylvania, it wouldn't have been an ear injury. Now, I've been to Butler. I'm from Pennsylvania. Butler General Hospital is a good hospital. They don't have neurosurgery there. If you have an injury to the head, you have a golden hour to get cared for. You were taken to Butler General Hospital. Because the injury, thankfully, was not as lethal as it was designed to be, it wasn't the problem. But if you'd had a head injury, you could have had your life saved. But without a neurosurgeon, and there is no neurosurgeon at Butler General Hospital, unfortunately, you wouldn't have an option because Pittsburgh is a far, far ride away. That's the closest metropolitan area where there are lots of neurosurgeons. But with this bill, this legislation rather, this funding of $50 billion, Pennsylvania got its share. And they're going to be able to build telemedicine hookups and telerobotic surgery that would allow an injured individual in a car accident or any other reason that is a head injury in Butler General and rural hospitals across the country to be able to access the best care our nation has to offer so rural America will not suffer. That's the promise of what this money offers to our nation. It's not just paying the bills, it's not just picking up the pieces, it's actually transforming using technology we have widely available in urban America, the way we save lives in rural America. Each state competed aggressively because for $1 billion, Mr. President, you'll fight pretty hard. And they gave us brilliant ideas that they're talking with each other about. So we're actually creating teams that now across state lines will connect because they're all Americans and they base their advances on several pillars. Secretary Kennedy can talk about MAHA because there's MAHA elements to this as well, but very precisely sustainable access. We ask states, how can we bring top care closer, like in the thought experiment I gave you for Butler General? In Pennsylvania and North Carolina, there are regional spoke models, which at hub and spoke means you've got a big hospital in the city and they adopt or work closely with some rural hospitals to solve the challenges of fragmented care. And that actually works. You share administrative back office work, you group purchase your stuff, you save money, you exchange medical records. Alabama has no OBGYNs in many of their counties. So they're doing something pretty cool. They're actually having robots do ultrasounds on these pregnant moms. So we can actually get those images back to the big center. So we know if the child has a problem and we know if that mother's at risk. We have one of the highest maternal mortality rates in the world, in the country with the best medicine in the world. It's often stated, people ask, does healthcare stink in America? Well, they don't like it. Would you leave America to get healthcare elsewhere? Nobody leaves. We have the best healthcare if you can get to it. We don't want rural America left behind anymore. As an aside, by the way, we talked about the most favored nation drug pricing. One of the first companies and areas we use most favored nation drug pricing is fertility drugs. That's why we're going to have so many Trump babies, because we've dropped dramatically the most expensive part of the fertility space. And so America no longer will pay so many times more. In their case, it was 10 times more for the same fertility drugs that they're available for moms who want to get pregnant in Europe. I want to thank Terry, who's here as a nurse practitioner, Andrew is a doctor in West Virginia, New Mexico. They're representatives of the workforce in rural America. But there are only two of them here representative because we don't have enough people working in rural America. It's a big challenge. So Delaware is creating its own medical school, their first ever medical school in a rural part of the state. So that can get more local talent that will stay local in those parts of Delaware. Michigan is launching the high school to healthcare pipeline grant program. They want to take kids out of high school in Michigan, local rural communities, and get them into the system, get them trained as nurses because they'll stay home because they're from those communities and they'll save lives for decades there. These are the types of programs that can get our rural communities and economies up to high gear and keep it that way long after this 5-year funding is done. And finally, tech innovation. Rural communities would benefit the most from high-tech advances, like we just discussed, possibly if there was a head trauma case. Many states want to partner with our CMS data interoperability network, was created by Amy Gleason, who spearheaded so much of the technology transformation in our government. It's going to support the president's pledge to provide transparency that he mentioned as part of the Great Healthcare Plan. And Congress can ensure these are all available for decades to come if we can get this legislation through. As the tech innovation forefront, just to give you a couple examples, Texas and Hawaii are making targeted investments in statewide telehealth, so everybody has telehealth. The best doctors for the best knowledge available where you are. We'll meet you where you are. If you're a vet and depressed and you're thinking of taking your life, we'll be there. Just let us know you're in trouble and we'll help. Alaska wants to deploy, and I'm going to hand it to Senator Sullivan in a second, wants to deploy unmanned pharmaceutical distribution kiosks and drones that will deliver medications, because in the North Slope of Alaska, you can't get there this time of year. So these technologies, they exist. Why we use them in Midtown Manhattan, we should use them in rural Alaska. This administration is committed to collaborate with all 50 states, all 50, red and blue, all 50 states, to carry out bold plans to tackle the challenges that local communities face. We're not pouring funds blindly, however, into a broken system. We're going to carefully, precisely, as the president said, target this investment. With healthcare front running rampant, and I was in Minnesota this week, Mr. President, it's worse than we've heard. But Minnesota, pardon the pun, it's just the tip of the iceberg. California is the varsity team when it comes to fraud, waste, and abuse. We're not going to let that happen. We want transparency for this $50 billion investment. We owe it to Capitol Hill. We owe it to this president, and we want accountability to be a top priority. For that reason, we've created a Office of Rural Health Transformation at CMS for long-term oversight. The office led by Alina Check Idalina again was one of the people who helped create this program in the forefront. She was in the first administration, Mr. President. She's going to guide states in implementing their rural health transformation plans, coordinate all the federal and state partnerships, making sure there's appropriate oversight. In addition, every single state is going to have a dedicated project officer. We will be there with you. We're going to help you. Please engage us. You've got lots of lives at risk. It's a true state-federal partnership, unbelievable, extraordinary milestone for healthcare. Your zip code will no longer dictate whether you have excellent healthcare. Your zip code will no longer be your destiny. It's not going to dictate your life expectancy. Mr. President, I cannot thank you enough for the leadership that it took to get this $50 billion investment in rural healthcare. They don't make a lot of noise. They just want to get the job done. You stood up for them in Congress. God bless you for making this possible. Please do it again. Please do it again for the great healthcare plan. Let me hand it to Dan Sullivan, who's a spectacular member of the Senate, and obviously Alaska, they're pretty raw.
Thank you, Dr. Oz. And Mr. President, I am very honored to be here. This is a really exciting day. I want to thank you, sir, and your team. Worked really closely with Dr. Oz, Secretary Kennedy, many others. You know, this is a great example of how Congress, working closely with your administration, can achieve historic things. This is historic for our rural health care, certainly in the Working Families Tax Cuts Act. You combine it with what you were talking about, sir, in terms of drug price reductions for all Americans. So these are two things that are happening right now in our historic, and I agree 100% with you, Mr. President, has got a lot of press, even though it is historic. It's going to really impact people in rural America, especially my state, this fund that I want to talk about. But what you've done on the drug pricing is even...
Ben, will you get Lisa Murkowski to vote for it?
She voted.
No, are you going to get her to vote for the great, big, beautiful health care bill that we're
When we get that, I think MFN drug pricing, I bet every member of Congress votes for that.
Get her to vote for it?
We'll work on it, sir. We'll work on it. So let me actually talk a little bit about the context of what's going on in Alaska and how this relates to it. You know, after 4 years of being locked up and shut down by the previous administration, we are on the cusp of achieving some huge goals in my state that we've been working on for decades. We have this huge resource development boom going on the north slope of Alaska. I was with a bunch of the Inupiat Alaska Native people who live up there. They are so excited about what's happening there. We are, as you know, Mr. President, building icebreakers. We're home porting some of those in Alaska. We have huge historic infrastructure and economic and national security investments happening. In particular, the gas line that you have championed so much, the big LNG project. All of these things are happening. It's really exciting. By the way, all of these issues I just talked about, all of those were in the Working Families Tax Cuts Act. So there's a lot of excitement. But, Mr. President, in addition to a strong economy, the thousands of jobs these projects are going to have, we have to have a strong healthcare system in every state. And rural Alaska, as you mentioned, as Dr. Oz mentioned, has often, almost always been an afterthought when it comes to investing in healthcare in America. And that's not happening anymore after the Working Families Tax Cuts Act. As you said, Mr. President, as Dr. Oz said, this is the biggest investment in rural healthcare in American history. $50 billion. The award the great state of Alaska was able to get working with Dr. Oz, and the parameters of the bill was about $1.4 billion over 5 years to transform our healthcare system. So that's really exciting, but here's the big deal. This is not just about money. This bill isn't just about money. The reason it's so impactful is that it's focused on letting states and governors design the system that they need. Alaska has many unique healthcare challenges, Mr. President, as you know, but for decades, the mentality in Washington, D.C. is this approach to one size fits all. DC tells every state, here's how you have to do it. And it never works. It never works. It certainly doesn't work in my state. I'll just give you one example. The federal match on Medicaid, our state typically has the lowest match in the country, even though we have the highest healthcare costs and highest delivery costs in the country. The one size fits all doesn't work. This bill is different. This bill that we wrote with your administration is all about allowing states to design a system that works for them with CMS guidance. And this will be a generational opportunity for every state to bring health care closer to home, to make it more responsive to the people who live in that state, and make it more affordable. I'll just end with this, Mr. President. Like I said, a lot of excitement. We got Governor Dunleavy, who sends his greetings, was hosting the stakeholders in Alaska who are going to be applying for these funds, working with CMS in our state. Over the last couple of days, we have over 300 people coming to these meetings on how to use this transformation fund to better healthcare in Alaska. And this is going to help my constituents, going to help every American, and it is really exciting. And I want to thank, again, you, Mr. President, and your team.
Thank you, Jim.
Thank you very much.
Oh, thank you very much. We're gonna have to go very fast. We are way behind schedule, and I have a couple of meetings that are very important. Nothing more important than this, but let's go. Come on, Bob. Rob,
Fire round.
please.
Mr. President, thank you very much for having me here today. And I represent northeastern Pennsylvania. Your governor from Scranton, Pennsylvania, so never had the opportunity to meet. But I inherited a very similar problem. Before I was even sworn into office, I had two hospitals, Moses Taylor and Regional in Scranton, that were eminently facing closure. And it's been, and working with Dr. Oz, Administrator Oz, and the CMS team has been absolutely incredible on so many levels. And thank you again for intervening and shepherding us through that process. But when you're looking at Pennsylvania, we're going to receive over $193 million. In 5 years, it will be over $1 billion for the Commonwealth of Pennsylvania. And when you think about northeastern Pennsylvania, clinics and regional hospitals, rural hospitals are the backbones of our communities. So making a targeted investment that is not just going to band-aid over poor operational procedures, it's going to actually transform rural healthcare. That's what we are so excited about. Pike County in my district is the largest growing county in the Commonwealth of Pennsylvania where there's not a hospital. The nearest commute to a hospital is over 55 minutes away. So these are going to be funds that will be so imperative. The unprecedented investment is going to be incredible, and thank you for having me up here and being a part of this journey.
Thank you, Rob. Appreciate it.
Thank you, Mr. President. This is a great opportunity to be here with you and your team. Dr. Oz has been a tremendous asset. The $50 billion commitment to rural health transformation is critical. New York State is going to see about $212 million in the first year, which is vital for workforce development, access to care, primary, behavioral, maternal, emergency, telemedicine, etc. How were we able to do it? Because we rooted out waste, fraud, and abuse in the system. And Democrats will just say we cut $1 trillion in Medicaid. That's not what we did. We said you need to be eligible. You need to be a citizen. You need to work if you are able-bodied without dependent children. We reined in the provider tax and state-directed payments, which have exploded over years. And we are taking this money, not only preserving Medicaid for the IDD community, our seniors, our children, our single mothers, but we're investing it in rural health. When you look at Obamacare, health insurance premiums have risen 96% since Obamacare took effect. Insurance revenues up 2,000%. Mr. President, you are 1,000% correct that the insurance companies are the problem. They wrote Obamacare. It's to their benefit, and the American people are being screwed. And so we can get a bipartisan agreement on what you are trying to do. When it comes to lowering drug prices, I will tell you, one of the largest pharmaceutical companies is in my district in Westchester County. I met with them in 2024, and I said, what would you do to lower drug prices? And the response was, go after the European price controls. You are spot on taking on the price controls that have been put in place. Most favored nation is the single best thing we can do to lower prescription drug prices here in America. The pharmaceutical companies will tell you that privately. And that is the fundamental fact. We need to go after PBM reform. Associated healthcare plans, we put that on the floor. Every Democrat voted against it, every Republican for it. Those would reduce costs by 11% because businesses, small businesses, would be able to pool together and purchase healthcare plans at a lower rate. We need to go after the PBMs and make sure that insurance companies are not owning providers and owning PBMs. That is what is driving up the cost of healthcare in this country. You've talked about IVF. I've been a big champion on this. We need to make sure the insurance companies cover it. I also have a tax bill to provide tax incentives to Americans, and what you have done to lower IVF costs on the drugs is critical. And you are 1,000% correct on expanding HSAs. I fundamentally believe that we can address the issues with Obamacare, make sure that the American people have access to care at a lower rate. We can get a bipartisan agreement to address the EPTC with expansion of HSA so that the money goes to the people and not the insurance companies. We are committed to working to get this done, and I thank you for your leadership. Thank you.
Mr. President, gigantic thank you, and thank you for your incredible leadership. Your courage gives me more courage to say it the way it is. We're working very hard in Nebraska to run government like a business. This investment into rural America, which, by the way, in all of Nebraska, you pull 85%. I don't know what the hell's wrong with the other 15, but your 85 is a pretty good number. I think, very, very brief, this plan will allow us to do common sense, pragmatic investments in rural Nebraska, and they will be sustainable. We will make sure that we don't need another dollar after 5 years. We are working on simple things like food. Real food is good medicine. We're working on making sure that all of our veterans, Nebraska is 500 miles long, 250 miles wide, no longer are veterans going to have to drive to Omaha to give care. We're going to take care of our veterans at home. Investments in technology so we can educate our children in rural Nebraska to provide health care are really, really important issues. And I think that the other is we've developed what we call 6 regions, 1 Nebraska, and that will focus and take advantage of those. So we're working on what we have and then being able to use these resources to also help us with mental health and drug care as well. So we're incredibly grateful. Nebraska, we work hard. We're about faith, family, hard work, the American dream, and we don't ask for much help in rural Nebraska. So we're really grateful for this investment. Thank you.
Thank you. Thank you for being here. 1 minute. We don't want to lose him, Susie. We'll see how it all works out, okay? Thank you, Kevin. Great job. And thank you for all being here as we discuss the largest investment in rural